Hi everybody, this is Dr. Clark Schierle, Director of Aesthetic Surgery for Northwestern Specialists in Plastic Surgery, and I have here our PA, Monika Czeszynski.
Hey guys, what's up?
And we're here with another educational video for you today on profound skin tightening. So the Profound is a really cool, minimally invasive, non-surgical skin tightening treatment. It is based on a platform of microneedling combined with radio frequency energy. So there's a lot of big fancy words, I'll try to break it down. Microneedling, tiny needles, they go into the skin. First of all, we numb you up so there's no pain with the procedure itself. Then those needles are used to transmit electrical energy, radio frequency energy. This provides a heating energy that causes your dermis, or the thicker layers of your skin, to create collagen. Collagen creates a wonderful foundation for thicker, tighter, smoother, more elastic skin. And it stimulates the fibroblast cells in your skin to create this collagen. And the results are really dramatic for a simple office-based procedure.
I would say the most common area that we treat is the neck. The Profound is a great option for those who are not ready for a neck lift, but need a little bit of a nip tuck without actually any surgery. So it's nice because it helps, that skin tightening for the neck and kind of improve the skin texture as well. We've tried it on cellulite. We have a little bit of experience with the Profound with cellulite. What are your thoughts on that aspect of it?
Yeah, I think it's one of the unsolved problems in plastic surgery is that ultimately the material that we're working with as we try to sculpt and shape the body is the skin. And a lot of times the reason why these patients need the procedure is the same reason why their skin might not respond as well to a given procedure. So if you do a neck lift and their skin is really sun damaged or older, then no matter how much you tighten it, it can swell and relax, and they can end up with a result that's not as spectacular. So sometimes we use it instead of surgery, sometimes it's used in addition to surgery to really help push a result that's good to a result that's fantastic.
Yeah, and it's great. I mean, it's a procedure we can do in the office. He did mention that we numb the whole area up. Can you kind of discuss what kind of numbing it is? Is it topical? Is it something that's going to be a little bit more involved?
Yeah, it's a little bit of both. The Profound is, as its name implies, it goes deep. So it is the deepest, most powerful skin tightening treatment available on the market. The needles go up to 4 millimeters deep, which is pretty deep. And the energy they deliver is the strongest, longest time constant. They actually have a patent on their time constant that delivers the most energy to the deepest depth. Because of this, it's a pretty strong treatment, and so it's typically performed by a PA or a physician, and we provide really a surgical level of numbing. So we will inject local anesthesia, and ironically, that's the part that hurts. The numbing is the only part that is actually painful. Once we get you nice and numbed up, the procedure itself is totally painless. So recovery time is really fairly rapid. There's essentially not really any pain or discomfort after the numbing wears off, maybe a little tingling or some stinging in certain situations. It might last a day or two. We refer to it as social downtime. So in terms of downtime, it's really, you may experience a significant amount of bruising or redness that you're gonna feel like looks a little bit weird, and so you're gonna be a little self-conscious around other people. That can last up to a week or so. In some of our best results, when the skin really has a good, strong response, you'll see little dimpling or little bumps on the skin. We like to refer to it affectionately as chicken skin. And that's a good sign that it really is going to deliver a fantastic result. But then of course you have these little bumps that can last for a couple of weeks, which can be a little annoying. But hopefully, like everything we do, it's all worth it in the end.
I mean, since this procedure is more invasive than just a traditional microneedling or skin tightening procedure, we pretty much tell all patients that it's a one and done treatment. We do tell all patients that what we're doing is we're kind of resetting the clock. So it really depends on how the skin continues to age. Can you repeat the Profound? Yes. Is it something that requires multiple treatments within a certain time period? No.
So how long the results last, as Monika was saying, is a function, kind of like with every cosmetic surgery we do, it's a function of, are we treating something that's happened or something that's happening? So if you experience a particular event, like a woman who's given birth to a couple children, for instance, and the skin around her belly button has stretched out a bit and has a little bit of crepey skin, if we treat that and she gets a great result and she's in her mid-30s, got great collagen, if she doesn't have 2 or 3 more kids, that really should be a permanent result.
Yeah.
In someone where we're treating the neck as a result of a facial aging process, this is a more ongoing issue. None of us are getting any younger. And so as Monica said, we're really just resetting the clock. You're gonna kind of have progressive laxity of the skin. We might tighten it to where it looks like we've taken 5 or 10 years off of you, but 5 or 10 years later, you might have relapsed to a point where you may benefit from another treatment.
Yeah, and I would say that the most difficult thing about this procedure is it takes time to see results. I have a lot of patients come in 2 to 3 weeks after the procedure and are expecting their before and after pictures to be astounding, but they're not. And the thing is that it takes about 2 to 3 months for really things to settle and for that collagen to build. So that's one thing that I do like to verbalize in the consultations, that it does take time, and I really need the patient to be patient with us. So yeah.
Perfect. So hopefully that answers some of your questions about the Profound. If that raised any other questions, you have any other comments, please feel free to leave them in the comments below. Make sure to click subscribe so that you can hear from us in the future. Turn on that bell for notifications, and we'll see you next time.
That's really good.